Welcome to the platform. My name remains Oluwaloche Da Silva. And with me on today's program is
Dr. Hadijat Olaide Raji, consultant obstetrician and gynecologist with the University of Ilorin and the University of Ilorin Teaching Hospital.
All right. We hear of family planning as a concept. What is this all about?
Yes, family planning, as the name implies, just means that the couple is trying to plan their family in terms of when do they want to have children, how many children do they want to have. So it just means that you're trying to plan the number of children that you want to have and decide on when and how you want to have them.
Okay. As a gynecologist, what experience do you have about family planning and what advice do you have for potentials?
Yes, I think family planning is very, very important because it just means that you're trying to have a life plan in terms of when do you want to start having children, how many children do you want to have, what is the spacing you want to have between your children. So it helps you to plan your family adequately within the resources and within your own, within the resources that are available to you. So I think it's something that every couple should actually take up and actively pursue so that they'll be able to give quality upbringing to the children that they have.
Well, there's this insinuation that family planning is the white man's idea of curbing African population. How true is this?
Well, I will beg to disagree because family planning is as old as mankind. Even historically, you have heard about stories of different methods that have been used right from time immemorial to plan the family. One of the common ones was in those days abstinence, for example. In those days, our great-grandfathers used, I would say, a form of abstinence because at that time, when a wife is pregnant, they will leave her alone and move to the next wife to have conjugal relations and all that. That's a form of family planning. So that means that throughout the pregnancy period, throughout the period she's breastfeeding, they don't even have any conjugal relations with her at all because they have other options of other women to go to. So that's also a form of family planning. So it's not something that was just brought by the white man, or a white man, sorry. But of course we have modern family planning methods. And we can say that these modern family planning methods were mostly developed in developed countries. But they are there just to ensure that we are able to have the number of children we want when we want them. And they have different methods available.
Okay. In the course of your practice, have you come across complications reported?
From family planning?
Yes.
Okay. One thing we should all know is that there is no ideal method of family planning. There is no method that works for everybody 100% of the time. And that is why we have different options for family planning. So some of them could have some side effects from one method, but having a side effect from one method of family planning does not mean that another method will not work for you. All right. So sometimes some side effects that have been reported, depending on the type of family planning, is something like sometimes some women experience some menstrual irregularities, depending on the type of family planning they're using. Some of the time, women claim to get pregnant while on family planning. Sometimes this is because they did not use it properly, the way it's supposed to have been used, and that could result in an unplanned pregnancy occurring.
All right. If there are issues in the usage of family planning, could you say whether there are some people who doesn't actually need it at all?
Anybody that doesn't need family planning?
Yes, maybe because of their body structure. Or...
I would say no. They say he who fails to plan plans to fail. So the same thing holds for the family planning thing. If you fail to plan how you want your family to be, that means you're already planning for failure of that family unit. All right. So you cannot say because of your body structure you're not going to use family planning. And like I said earlier, we have different types of family planning methods.
Okay. It is being advocated that teenagers and the youth should go for family planning. Which family are those people planning? Or is it trying to induct them into promiscuity? Okay.
So, I said earlier that when you're planning a family, you determine when you want to start having children. So for the teenagers, that is when. By preventing pregnancy, when they're in the teenage age, they are already determining when they want to start having a family. Okay, so abstinence is a form of family planning. Abstaining from sex completely is a form of family planning, because if you abstain from sex, then definitely you cannot get pregnant. All right. Using condoms is also a form of family planning. So it's a wrong concept believing that family planning just means using drugs all the time. There are different methods, and abstinence, like I said, is one method of family planning, which can be encouraged among youths by encouraging them to have relations when they are ready to settle down and have children. So we can encourage them, for example, to abstain from having sex. And if they absolutely have to have sex, they need to be faithful or to use condoms to prevent them from having an unwanted pregnancy or even HIV or other sexually transmitted infections.
All right. Still on this issue of family planning, do you think somebody who enters into marriage late, like maybe age of 35, 40, should still use family planning?
Okay. When a woman gets married late and wants to start a family, of course she's not a candidate to start using any form of contraceptive at that time, depending on her circumstance. So she marries late and she wants to start a family immediately. Then of course she starts the family immediately. But after she conceives and has a baby, okay, it's healthy for her body to have a space, to have some space before the next pregnancy, before embarking on the next pregnancy, so that her body can recover completely from the effects of the previous pregnancy that she's had before she embarks on another pregnancy. So it ensures that she stays healthier for longer and will also have healthier babies when she decides to have those children. Okay.
So from your experience also, is it peculiar to females to embark on family planning or for both sex?
Okay, when you're talking about family planning, ideally in a relationship, the man and the woman should sit down together and discuss about what they want to do in terms of their family size, number of children they want, when they want to have these children, the spacing between their children. All right. So with discussion, they can now plan and decide that, okay, we have male forms of family planning, we have female forms of family planning. They can now agree on which method they decide to use, and then they use that method. So it affects both the man and the woman.
All right. Now from religious point of view, is it advisable?
Like I said earlier, family planning is as old as man. All right. And I'm a Muslim. We know that even in the Quran it said that the woman carries a pregnancy for 9 months and she suckles the child for 2 years. So that is already implying that between one pregnancy and the next, you have minimum of 2 years and 9 months. That already implies family planning. So we cannot say that family planning is un-Islamic. I think it's something that's acceptable in Islam.
Thank you for talking to us on family planning.
You're welcome.